The biggest health challenges faced by people with albinism are mostly the fact that these people are vulnerable to skin infections. Why? Because the condition albinism has three main body organs that are affected. We have the skin, the hair, and the eyes. And when we talk about the skin, the biggest challenge is we have the highest risk of skin cancer due to the condition. And then we have visual disturbances as a result of the condition. The other challenge we have is there is social and emotional distress to these people. This is as a result of discrimination in the community, and then the stigma which comes with knowing the condition. The lack of knowledge in our communities about the condition, and this one predisposes the people with albinism to unnecessary criticism and then deprivation of very important care that they need as albinos. So, skin cancer is mostly prevalent among the albinos for a reason. We know that the albinos have this condition because they lack melanin. So the lack of melanin, we know that the melanin is part of our skin component. So that exposure that they get from the UV light from the sun is the one which predisposes them to getting this skin cancer. What we need to do is to make sure that first of all we are able to get control measures, because for example in the tropics in Uganda, it's impossible for you to say that you're going to shift these people from one place to another. But what we can do is to make sure these people have sunscreen, protective clothing, long clothing, and then favorable working atmospheres for these people. That's what they need. So people that are unable to get treatment as albinos, and of which these are the majority of the people, what happens is these people are exposed to ailments and diseases which would otherwise have been managed, and that therefore reduces their life expectancy. So the fact that these people can't afford this treatment, it means that there will be delay in necessary medical care for them, and then it means these people have to forego very important tests or treatments that would otherwise help them to increase their life expectancy. Conclusively, at the end of the day, if they are unable to afford this treatment, death is equally inevitable for them due to the untreated medical conditions. The beauty of having treatment machines for cancer in hospitals would be a very advantageous thing to them, because one, it would mean that these albinos would potentially get earlier treatment. They would have these conditions detected early enough, and therefore get treatment in time, and that would therefore improve their life expectancy. Equally, this would also reduce the financial burden. If we have the machines, the financial burden to these patients would be reduced, especially as individuals, and therefore their quality of care would also improve. The last thing would be that because the conditions that they face are usually detrimental to their lives, leading to death, what it would mean that we would also have more people being able to stay alive due to the life-saving treatment and care that they received from the early detection by the machines. Also, conclusive, the advantage would be that because these machines they help us maintain the integrity of these people's skins. to also have a cosmetic value to them. Because these people have no natural protection from the sun, people in Uganda are extremely vulnerable to this skin cancer. Also, the myths that are attributed to this condition in the country, for example, being referred to as caste people, as ghosts, and then in some communities being which believe that these people's body parts make people wealthy. Such myths and environmental predisposure make it very complicated for these people to survive, and therefore every support that is aimed at alleviating such conditions is welcome, and I therefore encourage you to support the initiative to change the lives of these people in Uganda. Thank you so much. My name is Joash Okirian.